name is Jilberry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'll be talking with Dr. Anna Royer, a new general surgeon who has recently joined Northwestern Associates in surgery. So welcome, Dr. Royer. Thanks for being here.
Thank you very much. I'm happy to be here.
So I know everybody's excited about your arrival, but before we dive into what you're doing here, maybe give us a little bit of background on your education and experience.
So I'm from Maine, and I went to college in Maine at Colby College. Then I went to Boston University School of Medicine for my medical degree, and I trained, my surgical training was at the University of Tennessee College of Medicine in Chattanooga, Tennessee. And then after residency and training, I went and worked in Maine at Central Maine Medical Center.
Great. Well, we have a connection. I'm from Maine, too.
Yes, I think that's great.
So you're going to be working with Dr. Mary Woodhouse as well?
Yes.
And where is your office located?
So my office is located at Northwestern Medical Center on campus at the Doctor's Office Commons on Crest Road.
Great, super. So yeah, right there at the doctor's office commons, close to the hospital, so you can go back and forth.
Yes, I think that's great.
That's super. So what type of surgeries will you be doing? So what will your practice look like?
So I'm a general surgeon, and here in this community, I'll be doing a wide breadth of types of surgeries. A lot of what I do is things like gallbladders, hernias, endoscopies, so colonoscopies and scopes down the mouth, as well as skin lesions and sort of that type of surgery as well.
Terrific. And you're actually replacing Dr. Salamone, who's going to be retiring later this year.
Yes.
So what has that been like as you've been working with him in your start?
So I had the great opportunity of working with Dr. Salamone when I first came, and that has been awesome. Dr. Salamone it's great to work with him, especially at the end of his career, because I think he's got a lot of information to pass on as he reflects back on what's been satisfying and successful for him. He's a very patient surgeon. He does a great job of talking to his patients, listening to them, explaining things well, and thinking very deeply and thoughtfully about what he's doing. And so that's something I respect a lot. So I feel very lucky that I've had the opportunity to come and work with him. And one of the most interesting things about working with him is how well he's been able to step back from being at retirement and put himself in my shoes as new to the community, and kind of help guide me through the transition, which I honestly I think that takes a lot of empathy and ability to just kind of think how I might be feeling. So I've loved working with him, and I can only imagine what it's like being a patient and having that same level of empathy. So it's been very nice.
Yeah, he's just been an amazing physician in this community, deeply caring, and what you're seeing is certainly what I've had the pleasure of working with him.
Yeah.
That's just who he is. And I think it couldn't be a better transition for him to have you here. It's when we started recruiting, it's like we weren't sure how long it would take, but it almost like when he said he was ready, you were there.
Yeah.
And he said, this is right. This is the right match for me. And so it was just wonderful. And to see him in this transition period and feeling so good about it, about his career and about passing on his wisdom to you. So it's been beautiful.
Yes, I think it's been awesome.
So you're one of 4 surgeons as well. So we talked about you and Dr. Woodhouse in a practice, but we also have Dr. Kennedy and Dr. Payne, so you still have that 4 general surgeons in the community to practice with.
Yep, and everybody's been very welcoming to me.
Fantastic, fantastic. So as we think about you, how did you get your start? How did this career even emerge for you?
So I don't know exactly when it was that I decided I wanted to be a doctor. I can find coloring books from when I was a kindergartner that said, when I grow up, I want to be a doctor. But so I don't know what that was all about. But my father's a family practice physician in Maine. And I'm sure that even though he never said that I should become a physician, I think that was probably a huge influence because he loved what he did.
Yes.
And does. He's still practicing. And so he was always very, just spoke very highly of the profession and, loved caring for patients. I worked with my father when I was in college. I was a nurse's aide for him. So I learned how to give shots and I drew blood. I assisted him whenever he did procedures in his office. I spoke with patients and got medical histories and medications and things like that. So that was it was a nice introduction to the field. I loved working with my father, and I really was hands-on. And I loved drawing blood and things like that. So as I went through college, I knew I wanted to go into medicine. I ended up majoring in a language. It was Japanese. I was East Asian Studies, Japanese. Yeah.
Wow.
And so it's kind of an interesting thing because most people are, sort of associate biology majors with being a physician. And I've thought a lot about that. How did that even happen? But I really think that a lot of the language and sort of being a language major, a lot of it goes along with culture and communication and how we interact with each other. It's just, a different culture than what I grew up in. And I think medicine has a lot of that as well. Yeah. And that's a lot of what we do is understand where somebody different from you came from and, their values are and how you communicate with them. And anyway, so I ended up in medical school and didn't know I wanted to be a surgeon then, but I kind of thought a lot about surgery, and I'd go to the meetings if you're interested in surgery, and then when I finally rotated and scrubbed in the OR, I just loved it. And from the first day, I loved it, and I love using my hands. I love being in the OR, and when it came to the end of the rotation as a medical student, and I imagined never going back, I was totally heartbroken. So I knew it was a good fit for me.
Ah, fantastic. That's great to learn so much about you. I love these shows. I get to learn too. So you've also seen patients in South Africa and Guatemala. Tell us about that experience.
So when I was a medical student, I had the opportunity to go to a country, Lesotho, which is surrounded by South Africa. And it's kind of interesting because my father, when he was a medical student a long time ago, he went to school in Oklahoma and went to Lesotho as well as a medical student. Mm-hmm. But Boston University does a lot of outreach projects throughout the city, but also globally. And one that they had was a relationship with a hospital in Lesotho, a small hospital where they're trying to bring sort of a family medicine residency program there. And so at the last minute when I was a fourth year student, some student dropped out of that rotation and I had a slot, so I went. And so it was kind of exciting to go, 30 years after my father had gone.
Exactly.
And, but the scene had changed a lot in Lesotho at that point. Lesotho, when I went, was the country with the third highest rate of HIV/AIDS in the world.
Oh, wow.
And so a lot of what I did was treat HIV/AIDS patients, TB. I was part of the male medical ward team. Mm-hmm. And so I got exposed to a lot of different types of disease processes and things like that I wouldn't have seen in the United States. So it was a very powerful experience and something that I think about frequently. In residency, I had the ability to go back, travel, and went to Guatemala. We had a surgeon that would go annually to a part of a smaller town in Guatemala, and so I got to go and operate for a week, and that was also really great. We delivered a couple of kids with a C-section there, and so all the residents that go after me update me on how the twins are doing. So
how cool is that?
Nice.
Yeah, that's awesome. That's great. All right, so you're in Vermont from Maine, and what is this that I'm hearing about a possible sheep farm?
So I'm from a small town in Maine. My hometown is 900 people. We're very much an agricultural part of Maine. Also in the mountains. We're not coastal, we're mountain Mainers. And near Freiburg, which maybe people know the Freiburg Fair.
Oh, probably. Yeah, probably there's
a
fair
big
goers here, yeah.
Anyway, so we raised some animals growing up, not a lot, but enough that it was part of the way I was raised, and my grandparents were farmers.
Okay.
So I've always loved that. My husband he's a city slicker. He's from Boston, but he's excited about it. His family heritage is from Ireland. Okay. And so whenever he goes home to visit relatives, there are sheep everywhere, and we talk about it. And so we've kind of got excited about trying to merge the two histories and raise some sheep.
That's so cool.
It may or may not work. We don't know. But we're excited about it.
But it's okay. That's fantastic. So what do you do for fun? What do you do to balance and stay healthy besides your sheep farm you're going to have?
So I love to run. My husband and I met a long time ago on a marathon team. We raised money for the Leukemia and Lymphoma Society, sort of as, we were training and we both were new to it. So people would donate money like, you guys are going to do that? I can't believe it. So that was part of how we met. And I got really into it, got really excited about it. I was on that team for 5 years. And my husband was on the team a year before I joined and then has remained on it. So he's been on for 14 years straight running. Wow. So that's become a large part of what we do. We try to run marathons and train and run together. And I wouldn't say we're super fast, but we like it. So that's great. That's what I enjoy doing.
That's great. Well, it's good that you're in Rise, Vermont country, right? So you're role modeling, embracing healthy lifestyles, and there's staying active.
Lots of great opportunities for running around here, the trails and the areas like that. So I'm excited to learn more about that.
That's terrific. Well, I know our time is getting close, but I see you, a young general surgeon. This is fantastic. A lot of folks would aspire to be where you're at. Do you have any words of wisdom for young women, girls who are thinking about where to go for a career and what they should do?
I think they should. Honestly, I think that if someone is passionate about something and they're interested and they want to put the work in, they should go for it. Yeah. I think that, of course, a lot of things that come up with gender is balancing life and the expectations of what their home life would be, or raising children. And I think that you can find many different examples of how people do it. And so I wouldn't let that limit anyone. I think finding role models in both genders, men and women, that have the life that you would like to emulate, and that the kind of person you'd want to become, and make the younger you proud of being. I think that you should go for it. I think
absolutely. Well, I think about Central Maine Medical Center. I went to nursing school there, so I keep coming back to our Maine connections and both of us having families in Maine. So it's I have clearly felt that this is home for me, and I hope you feel the same.
Oh yeah, I'm very happy to be here.
Yeah, it's terrific. So just in recapping, we've talked a lot about you, but we can find you at Northwestern Associates in Surgery, right on Crest Road in Doctor's Office Commons 1, and they can call Northwestern Medical Center to find you, to book an opportunity with you.
Awesome.
So, great. Thank you. Thanks for being on the show.
Thank you.
I'm Jill Bowen, CEO of Northwestern Medical Center, and your host of the Health Beat Show. So great to have you here, and it's so wonderful to have Dr. Royer joining us as Dr. Salamone transitions into retirement later this year. So thank you for joining us.